Hi there viewers, Dr. Mashhood again with another video. In this video, what we're going to do is we're going to start off by explaining the different OSCE scenarios or stations. Today we're going to talk about a very common station which comes in most of the fellowship and membership exams in emergency medicine. It's also known to come in other membership exams, for example in physicians exams as well. The concept of this is very clear. We're going to go through dissect this station in this video, and in the next video, coming up video, we're going to do a practical demonstration for this OSCE. The name of this OSCE is Breaking Bad News. Working in an emergency department, it's imperative the physicians are well aware of the concept of how to break a bad news. And that is the main reason why this station is most frequently occurred in most of the fellowship or membership exams. So what do we do when we talk about a Breaking Bad News OSCE station? There are a few basic things. The basic things which have to be done in this station are the things which needs to be done in every other station as well. Let's start off. First of all, the setting. What do we mean by setting? The concept of setting is that you should be appropriately dressed. I mean, you should have appropriately sized scrubs, or if you are in the habit of wearing a lab coat or a tie and shirt, then it should be appropriately ironed and pressed. Your presentation as a physician is extremely important. Along with this setting, especially for breaking bad news, you should make sure you verbalize to the examiner that this breaking bad news I would do in a separate room and probably with a chaperone, such as an in-charge nurse or a resuscitation nurse or the nurse who's looking after the care of the patient. Just to summarize, in the setting, one needs to be appropriately dressed. He needs to mention early on at the start of the station that this discussion of breaking bad news needs to be done in a separate room along with the chaperone, ideally the nurse looking after the patient. Then comes the introduction bit. Now the introduction bit of a physician in an OSCE station needs to be consistent. You need to mention clearly who you are, and you need to mention clearly what is your role, what is your designation, and how are you involved in this patient care. For example, if I'm looking after the patient, I will clearly verbalize to the examiner and to the candidate and to the patient or the patient's relative, which I'm doing this OSCE station with, that hi there, my name is Dr. Mashhood. I'm one of the emergency medicine consultants. I am looking after patient XYZ. So your introduction needs to be clear. It should mention your role, and it should mention how are you involved in the care of the patient. So setting and introduction. Then comes the real thing, the real meat of this OSCE scenario. The first come is you need to thank the relative who's come to speak to you. That will help to establish a rapport, and that will help to break the ice. Establishing a rapport in any OSCE station is extremely vital, because that will reduce your anxiety and also help make the relative or the patient who's involved in this OSCE realize that at the end of the day you are a physician who's looking after this patient. So after your introduction, thanks the relative that you have attended. For example, what I would normally verbalize is, thank you very much for attending this meeting. Can I just confirm your name and your relation with the patient? Establishing the name of the person you're speaking to and the relation of the person you're speaking to with the patient is extremely important. Then, later on the scenario or the OSCE, you can mention the name of the person instead of telling them, addressing them in different means. Asking them, addressing them with the name would again help to establish the rapport. After the setting, introduction, thanking for the meeting, and then establishing the name of the person you're talking to and the relation to the patient. Then you need to assess how much that person knows what's happening with their relative. This will help you not to start from scratch, because again, OSCE scenarios, the OSCE stations are time limited. So what you don't want to do is start from the scratch and then come to realize that person already knows that information. That will help by asking the person how much they know about what's going on with the patient. It's an open question. That will first of all give you time to listen to the person, allow that person to speak, and then allow you to assess how much they know so you can carry on from there onwards. This is vital because that will tell you how much you need to reveal the information. Then after you've established what they know, then you're going to start off by what they don't know and what are the important parts of that scenario. That it doesn't matter what that scenario is. At the end of the day, you are there to break bad news. So you need to start off from where that person has left and give further information. Then you need to summarize the findings, summarize what they know, what you have told them, just summarize nicely in one sentence, and then confirm and check the understanding of that summarized phrase. It's important because you need to be clear that person you're talking to understands the gravity of the situation. After you've summarized it, then you need to give what we call a warning shot. The warning shot, what we mean is, instead of going directly and explain and telling the person that your relative's going to die, you actually tell them as a warning that your relative is not doing very well. Or you can say, I'm afraid to tell you that your relative is not doing very well. What will this statement do is that will prepare that person that there is some bad news coming up. After you've given the warning shot, then you need to give some silence. Allow that information you've given to the person for them to understand that. After the silence, then you need to tell them in clear terms that your relative will die. It's essential that you mention those words. In this scenario, what you don't want to do is mention other terms which does not have a clear message that the patient is going to die and the relative understands, or the person you're talking to still has hope that the person will live. So you have to clearly mention that the patient will die after you've given the warning shot. Then again, you need to give them silence, and if they have any episodes of crying, then you need to offer them tissue papers. This will tell the examiner and the person you're talking to that you have empathy. Extremely important to gain some extra points. After the warning shot and after the information you've given, silence again, offer them tissue papers. Then you need to ask them, is there anybody else you want us to call? In other words, you're offering them, do you want us to call anybody else or any other relative? In other words, you are giving them, offering them help in these difficult times. Then you need to explore a bit more for extra points or extra marks. You need to explore a bit more about the patient itself. You need to ask them about their religious beliefs. Like, were they really religious? The reason you're asking them about the religious belief is if the patient was extremely religious, then you can offer them an imam if they were Muslim, or a pastor if they were Christians, to come and be on the bedside of the patient because they will eventually die very soon. After exploring the religious belief, then very important, you need to ask the relative, what was the patient's belief about organ donation? Or has the patient ever mentioned about organ donation? If the patient did mention about organ donation, then you can tell them, I will get in touch with the organ donation team and they will contact you shortly. If they haven't mentioned or discussed about organ donation, you can ask them, would you like to read about organ donation? And you can offer them leaflets. Again, important religious aspects and organ donation are very important to give you extra marks, and those extra marks could make all the difference between passing the station or failing the stations. Then a few more sentences, a few more points you need to mention. Then you need to say to the relative that rest assured we will keep the patient comfortable and we will make sure he or she doesn't have any pain. Mentioning that you will keep the patient comfortable is extremely important. Again, it highlights the empathy as the physician is showing towards the patient. In the end, you can offer them that we will, for maintaining privacy, we will move the patient to a side room where we will allow you to come and spend some time with the patient in privacy. Along with empathy, you're also giving some privacy or private space. And the most important, the way you're going to end this station is you're going to offer the relative the timings of the rest of your shift, that I'm available till 8 o'clock p.m. for example. If you have any questions, you can either come back to me or the nurse who's accompanying me, and we'll be more than happy to ask any other questions or queries. Because what might happen is some other relatives might turn up and they might have some other questions which the person you're speaking to hasn't got the answers. Then by asking them and telling them that you're available for the answering the questions or any queries, again shows empathy and professionalism. So just to summarize, the setting is important. In the setting we mentioned that you need to be appropriately dressed, mentioning to the examiner that you would do this station in a separate room to maintain privacy, and along with the setting you will have a chaperone or a nurse going along with you to speak to the relative. Introduction is important. In clear terms, you will need to mention your full name, your designation, and how you were involved with the patient. Thanking the relative for coming and having this meeting, and also making sure asking for the name and relation of the relatives with the patient. Then assessing how much that relative knows about the condition of the patient, so that you can start off from the things they don't know, which will help you save time. And then in the end, summarizing whatever the relative knows and whatever information you have given, so as to check the understanding of the relative. Once you've established they've understood the information which is there for you to offer, then you will mention a warning shot, so that you are preparing them mentally for the bad news which is coming up. After the warning shot, in clear terms, you will mention that this patient will die, and you will not use any other phrases. You need to mention it clearly depending on the scenario you've given in the exam. Then you will offer them silence. You will offer them tissue papers if they are crying or if they become emotional. Then you will offer them, if they want to get in touch with the other relatives, and you will offer them that you can give them a phone call. After that, you will explore the religious beliefs of the patient and whether or not organ donation has been discussed. Again, you're going to mention clearly that you will keep the patient very comfortable, showing that the empathy. And then after that, you will mention that you will offer them a side room so that they can spend some time with the patient in privacy. In the end, you will make sure you give the information that you or the nurse is available for the rest of the shift, and if they have any questions or if their relatives have any questions, they can come and contact them at any time. Hope this description is useful. In the coming videos for the Breaking Bad News OSCE, we're going to do a practical demonstration, and then we will dissect what the candidate did well, what they could do well next time, and how is the best way of passing these stations.